The logistical puzzle of giving out 2 doses of COVID vaccine separated by 3 or 4 weeks to hundreds of thousands of people so far in Oregon is not an easy one to solve. But it seemed Oregon did have a clear plan. As recently as January 22nd, Dave Baden, the chief financial officer of the Oregon Health Authority, brought in to coordinate the state's COVID response, said groups giving out vaccines should hold back half.
Again, as Director Banks said, under our approach, we expect all our vaccinators are reserving second doses for people who've received their prime shot. Keep that in mind when you hear people claim there are thousands of doses sitting on shelves in Oregon. Remember, we could provide more doses. We could provide doses to more people in these populations. We allocated all of our 100,000 total doses each week in that way. But we don't think that's responsible until we get further direction from CDC and the manufacturers to spend doses in that way.
The OHA posted Baden's comments later that day on Twitter to reiterate his point. It seemed like a reasonable explanation. There's just one problem. It's apparently not happening. When we reported 12,000 doses reserved for teachers at the Oregon Convention Center mass vaccination clinic would actually be 6,000 because the other half had to be set aside, we were later told that was not correct. And just this week, a spokesperson for the clinic wrote, rather than holding back doses, we're planning for them based on anticipated allocation and appointment availability. Which is more in line with what Dr. Anthony Fauci said this week. It's the national policy, he said, do not hold back doses.
Means rather than holding back on doses that would be designated for the second dose, given that we now have more and more confidence in the even flow of doses to go to locations, we're going to give a 3-week window so that people will know the doses that they're going to get and when they're going to get them. We don't want to hold back things.
He said a simple system would include using all doses as fast as possible, but making sure that people who need that second dose would get priority over everyone else.
In other words, if you give 50 million doses to individuals, and then the next time around you get more doses, when you're at that 3rd or 4th week, the first priority will always be to get the people who've gotten their first doses to get their second doses.
Which brings us back to the question of what Oregon is doing. In the 11 days since the OHA's COVID response coordinator said vaccinators are supposed to hold back half their doses, the OHA has refused to answer pointed questions about that statement, but instead issued a brief reply saying, no doses are being held back. If this is about second doses, we are allocating enough second doses to cover all first doses given out to vaccine providers currently. We've asked the OHA to take us behind the scenes and show us how the vaccines are being divvied up around the state. We think that you should be able to see that and understand how it's happening. So far, no response. We'll keep asking. In Northeast Portland, Pat Doris, KGW News.